Hello, I'm Sam Rajaratnam, consultant orthopaedic surgeon. I'm a knee specialist and I treat a number of acute and chronic knee injuries throughout various hospitals in southern England. A knee replacement is a procedure whereby an arthritic surface, that is a worn surface of the knee, is replaced with an artificial surface. This procedure has changed tremendously in the last 40 years of the development of surgery, and these days only a very small amount of surface is taken off and replaced, and it may be better described as a knee resurfacing procedure. I'm passionate about the latest techniques of achieving excellent results following knee replacements and have developed a number of enhanced recovery programs enabling patients to return to function quicker than they used to. These days we streamline the procedures within the joint replacement units that I work in, enabling patients to start moving their knees within an hour of surgery and walking at least by the next morning. The success of knee replacements not only depends on carefully done and carefully chosen surgery, but it also depends on the type of implants that are chosen and also the patient's motivation in getting the knee bending, which is a key and critical part of the recovery following joint replacement surgery. It is certainly hard work in the first few weeks, but the results are very encouraging, and our National Joint Registry in the UK now shows that knee replacements are lasting 15 to 20 years and longer if done correctly and the patient is rehabilitated well. I am passionate about the latest enhanced recovery programs and have instituted these in a number of hospitals that I work at, where I undertake knee resurfacings or knee replacement procedures, and every procedure will be specifically designed to the patient's needs and their anatomy. The Enhanced Recovery Programme is the programme by which we increase the effectiveness of joint replacements and get patients going and moving much faster, thus reducing the complications of surgery, reducing and improving the patient function and comfort. It enables the patient to go home after 2 or 3 days following joint replacement surgery and achieve an excellent range of motion and return to pain-free function sooner. The Enhanced Recovery Programme involves explaining to the patient before they come into surgery what is going to be required of them, streamlining the anaesthetic, and usually a combination of a very low-dose spinal anaesthetic and sedation or a light general anaesthetic is used in the vast majority of patients. During surgery, the surgery is kept to a minimum time required. A very high flexion knee replacement which removes a minimal amount of bone is used, and the knee is post-operatively flooded with a local anaesthetic to reduce the bleeding and increase the comfort. The patient then starts moving their knee virtually half an hour after surgery, and the physiotherapists then treat them over the first 2 or 3 days to get the knee bending and achieve optimal function. Patients often need post-operative physio and perhaps some hydrotherapy, and most return to good function within 4 to 6 weeks following joint replacement surgery. It has increased the patient satisfaction rate following joint replacement surgery tremendously, and the results are now very good throughout the UK.